Thank you. Thank you very much for inviting me here. As Alessandro mentioned, I'm a patient, a former patient. So I would like to share a little bit with what I went through and my experiences. So you're never prepared for a cancer diagnosis, whether you are 30, 50, or 70. And when we get it, the first thought that pops up is, am I going to die? Who will take care of my children, and who will take care of my cat? But I survived both times. First time all alone, just with my family and friends. The second time with a strong network of women who have made the journey before me and who were there when I needed to talk or to cry. Since I went through the whole process once 7 years ago, I prepared for what was to come the second time, chemotherapy, surgery, radiation. Yet my second journey was completely different. I had an amazing nurse who saw me, not my diagnosis. She took the time to call me, talk to my family, and arranged all the practical things, from fixing the transport after my treatments to forcing me to eat. I had a fantastic oncologist who was open to ideas and who saw me, not my diagnosis. She knew I consulted Dr. Google and PubMed, and I had amazing suggestions for my own treatment. A lot was dismissed firmly, but a few ideas were analyzed, and we made a joint decision about tougher treatments. I had an amazing surgeon who saw me, not my diagnosis. And she agreed to remove my second breast, the healthy one, even though she tried to persuade me and presented the research data that reconstruction theoretically should be a better solution for me. A new era with available information 24/7 places completely new demands on you, the healthcare profession. You must be up to date on the literature and be the authority. But in the same time, you must be humble and open, because sometimes the patient really does know better than the doctor. Be honest. Tell us when you don't have an answer. Give us access to information, because we Google no matter what you say. And above all, see us as individuals. We are so much more than our diagnosis. Our everyday lives must work, our loved ones must receive more support, and we need to know who to turn to. Apart from being a patient myself, I also represent the Breast Cancer Society Amazona in Stockholm, and we are a patient organization consisting of breast cancer sufferers and their relatives. We have about 2,000 members and collaborate with 80 volunteers. The Breast Cancer Society Amazona was founded for more than 40 years ago and has worked with networking and supporting breast cancer patients in the Stockholm area ever since. And totally, we are about 11,000 in Sweden, because we have some sister organization as well. So we see challenges with today's healthcare system. We live longer. New medicines mean that even patients with more advanced diseases have better prognosis, but the infrastructure used in health care does not seem to keep up. We still think one diagnosis in a time, one medicine at a time. Doctors and nurses are expected to know all about new treatments and monitor the latest research worldwide, but nevertheless, we patients demand more appointments and more engagement. And on the other hand, you have to have more documentation and you have more administration as well. Digitalization is a hugely popular topic right now during the pandemic, but we notice that digitalization is not the easy answer to all the problems. We patients still need to meet the healthcare profession in real life, because sometimes we don't want to talk to a screen. On the other hand, make use of the tools that exist in those situations where it would work to use them to complement the real-life meetings. Include smartwatch, Zoom, Teams, and other meeting places, because many of us have access to that. Amazona's support of breast cancer patients has a natural place in Stockholm next to the healthcare professionals. We are welcome to join healthcare management meetings and round the table talks. We are in direct contact with everyone is professional, but we didn't get it for free. It took us over 40 years of hard work and effort to get there. We are a strong association with sometimes loud opinions, and at times we do not agree at all with the healthcare professionals, but we really value the cooperation and want to increase it. So my message to you, please don't be afraid of patient organizations. There are ways to work together and to use the experience and the expertise. Invite and open up. We have the willpower, the opportunity, and the passion. For the patient to be in the center, you must include us in your network in a systematic way with clear roles and clear rules. We must be involved in the dialogue and the decisions. So please don't talk about us. Talk with us instead. We are there no matter what. Thank you and enjoy the session.